Hello everyone, this is Bonfire Madigan. We're not crazy, the system is. Tune into the Radical Mental Health Show hosted by the Freedom Center, Wednesday nights, 6 to 7 p.m. on Valley Free Radio, WXOJ 103.3 FM.
And this is the Freedom Center's Mental Health Show. I'm Will Hall, and I'm joined in the studio with
Molly Herder.
Hi, Molly. And today we've got a really great show for you. We are going to be interviewing Dr. Michael Smith, who is he's the clinical director?
He is the director, yep.
He's the clinical director of Lincoln Recovery, which is a clinic in the South Bronx in New York City, and it specializes in drug and alcohol treatment. It has a very interesting history that comes out of the Black Power movement and the radical movements of the 60s, and developed a whole acupuncture treatment for drug addiction that's been extremely successful. It's the NADA protocol for drug addiction, and Dr. Smith is going to be telling us about that, and we're also going to be talking about heroin addiction, methadone, alternatives to methadone, and discussing the war on drugs and what we might do about it as people who are concerned about people's mental health and also concerned about liberation and fighting against depression.
Right, this is Dr. Michael Smith from the Lincoln Recovery Center in the South Bronx. He's the director of the Lincoln Recovery Center, and he is also a active, I believe, founding member of the National Acupuncture Detox Association, which is happening throughout the United States in different states, which is a group of acupuncturists practicing this 5-point protocol.
Yeah, and the website for this is acudetox.com. Dr. Smith, can you hear us there?
Yes, I can.
Oh, great. Well, welcome to the show.
First of all, a correction. NADA is not a group of acupuncturists. It's a group of clinical people who have learned a very simple part of acupuncture. About 90% of the people in NADA are not professional acupuncturists.
Yeah, that's a very good point, because it's a specific protocol has been trained to a lot of different people around the country and around the world. I guess for people who don't know anything about this at all, can you just maybe tell us a story of how this all got started? Because I know that it very much came out of the ferment of the 60s in the South Bronx, and you were there, right?
Well, you sort of got your decade wrong, I think. I was there. There were a lot of protest activities and change actions and so on. Most of them didn't have much to do with what we're doing, because reaching out to people who are using drugs is not a part of very many agendas, really. But some of it did, and some of that was very important sort of beginning. We had a community takeover of one part of the nurses of the Lincoln Hospital that was a somewhat abandoned part. Mm-hmm. And some of the clients came in who wanted services, and at the time there were very few services available.
Okay, so in what
1970?
1970, okay.
And the program we started was what you call a Methadone detox program, where you have a 10-day tapering down cycle of methadone for people using heroin. In the South Bronx area at that time, there was a very, very high number of people using heroin, really of all ages. It was very common. And there were, even the conception of services wasn't that good, the ideas that people had. We were the first outpatient detox program. All the rest of them had all been inpatient and therefore expensive and awkward to run. So we, first day we had about 200 clients lined up outside and had essentially nearly entirely volunteer staff. Later on there was funding, and so that a great number of the volunteers were able to get positions, but that was maybe 6 months after we'd been running what was a large program on a volunteer basis. And all this took place in Lincoln Hospital, which is one of the city hospitals, and the hospital itself was nearly always sympathetic to the possibility, but sympathy doesn't pay the rent, so it took New York State funding to make it more stable.
At what point did, because you mentioned that you started with methadone treatment, at what point did that sort of, I mean, what was the results of that, and at what point did sort of acupuncture become something that was offered?
Well, methadone on a 10-day detox cycle gives a certain benefit, but patients tend to cycle back and forth, and you get what are called post-withdrawal symptoms. That is, just 10 days doesn't eliminate the symptoms and depression and strains that people have. So we read about acupuncture in the Times, actually being used in Hong Kong for addiction by Dr. Wen. We read about that in 1974. So at that point, we used acupuncture as an adjunct treatment to what methadone was doing. We continued that way until 78 or 79, when there were changes in the hospital location that made it not possible for us to provide methadone on a legal basis. And then it took 2 or 3 years before any of us were really clear that acupuncture could retain a high volume of patients the way that methadone does. So the program was the acupuncture protocol began to become clear about 80, 81, 82.
And so originally the methadone treatment was not a maintenance treatment, it was a tapering people off over 10 days, is that correct? Or?
That's correct, yes.
Mm-hmm. So I guess that's different than a lot of the programs that we see now, which is a long-term, is that?
Well, there are still methadone detox programs, but the majority of programs, I would say, are probably methadone maintenance programs. Some of those programs keep people on for a year or two. Some of them keep people on for dozens and dozens of years, and hopefully the whole process is individualized, but it doesn't offer as many possibilities as people need.
What are some of the risks that you see coming along with methadone treatment that you don't see necessarily with acupuncture?
Well, I don't know how much either of you know about methadone treatment. I don't think we've ever talked about it and so on. Methadone treatment in itself doesn't have very many risks, provided the person more or less takes the amount that they're given. The issue is that maybe you can help them better and have them provide a better advantage by doing something that will not be just a permanent compromise. There are a lot of people who can't do much more than just continue on methadone, but that's very often not true at the beginning, and you have to provide services that can help people, services that give drug-free support, services that are more psychosocially aware and flexible, and vocational training and whatever is pertinent to that person. Methadone has side effects. They're not good, but they're not particularly terrible. And that isn't the issue. The issue is the person needs to keep growing and keep moving and keep doing something. And the program has to be willing to be as flexible and optimistic as the patient is. that isn't always possible in terms of fundings and laws and so on. And since methadone's a medication, those who mainly use medications, that's the only pill they're given. And so the treatment needs to get beyond the issue of is there a medication to is there life, is there spirit, is there potential for growth and change in this person. And to a great degree now, I think that's much more obvious than it was in the 70s. Anyway.
What kinds of issues are people facing that contribute to drug addiction? Because it's primarily low-income people of color that are at the clinic.
No. In our clinic, since we're in a poor neighborhood, we have mostly poor people coming. People who use drugs in general, it is seriously false to say that they are mainly of low income and they're mainly poor.
In fact,
that just isn't the case.
In fact, the rates of, we had Tim Wise on the show a few months ago, and the rates of drug abuse among middle-class white people are higher than they are among people of color nationwide. So the people at the clinic, that the Lincoln Recovery Clinic, are people of color and low income. And how is the acupuncture protocol? Can you say more about it, what it is that the clinic offers and how it's been helping people?
Well, we are a licensed drug-free outpatient program, so-called medically supervised program, and there are a lot of things we're supposed to have, which we do have, and a few things that we try to add. The basic thing is that you need to offer what are called intensive services. That is, the person has to be able to come in as many days of the week as they can and spend time and make connections with other people, with our staff and with other patients. In individual settings and group settings, they have to start looking at how they're going to support themselves in terms of jobs and access to health care and different things that they may need, access to schooling. There are a lot of issues. Those issues are the same if you're talking about white people as people of color. The difference is that if you have less advantage in this country, you get more likely to get in a bad situation. But when the person's in a bad situation, most of those issues are very similar, and it's a real mistake to see them as different. Anyone working with unemployed, poor people who've had a lot of exposure to the child welfare system and other criminal justice systems, the issues are the same. A lot of it is you have to go beyond the hand that you've been dealt and take the advantage you have that you're alive, that you have spirit and you have possibility of change. And the program has to focus on that. Acupuncture helps all those things happen. It helps people listen. It helps people have a sober vision of themselves. It helps people be more comfortable. And it's a reliable, simple thing that they can access very easily. That offers the safety net and relaxation and balancing and so on that people often try to get from drugs, but drugs don't really provide. They provide the illusion of safety and the illusion of those other things.
So how, for someone who doesn't know anything about acupuncture, how is it might sound kind of mysterious that we're talking about acupuncture and drug treatment here. How is it that it actually works and helps people, or is that even important?
Well, it's important if somebody's not going to give you any money unless you tell them the answer.
Right.
Acupuncture has been used for thousands of years in Asia. It involves putting a small, thin needle just under the skin and different parts of the body, and certain points have certain kinds of effects. The treatment that we do at Lincoln is a simple ear point treatment, 3 to 5 points on the outside of the ear. And it's a easily learned protocol, and you do it in a group that might be anywhere from 10 to 50 people in the group. And people will sit there for 30, 40 minutes. And the effect of the treatment lasts much longer than 30, 40 minutes. It can last for days and sometimes longer than that. But in the beginning, people need fairly frequent treatments. The treatment helps the person help themselves. It helps them be more calm. It helps them be more open to information and so on. Helps them sleep better. Helps calm the highs and raise the lows and so on. And a person can say, well, how does that happen? It happens the same way that we help ourselves. So you hear good news on the telephone, you feel better. You have a comfortable sleep, you feel better. Each of us has the potential to feel better, and acupuncture taps that potential. And even people who are very troubled and have delusions and voices and this and that and the other, you get really quite a substantial improvement with acupuncture. That is never to say that acupuncture alone is an adequate treatment, but it's a very good mix for people with quite serious problems.
And have you, I imagine that you've been doing studies and research and tracking that demonstrate the effectiveness. What kind of results are you getting compared to other more traditional programs?
Well, there are different ways to look at this. First of all, just on a basis of individual effects, if you give acupuncture in a jail or a prison area, the rate of violence in that area will drop about 90%. And the rate of violence being determined by the correction officers reporting fights and so on. And this effect is so substantial that in England, for instance, acupuncture is used on a 5-year service contract in 130 different prisons in England because they want to have that kind of advantage. The prisons here are more run by medical people, and medical people are often not quite so willing to look at things that are outside their training, although there are 4 or 5 prison systems in the U.S. that use acupuncture quite a bit. On another way of looking at this, you say, okay, is this going to help retain people in treatment? The big outcome studies for drug abuse treatment all talk about the more days the person is in treatment, the better the result is. These are the RAND study and the Cal Data study. So if I have a method that helps people retain and stay in treatment longer, then that's going to make a dent in what we're doing. With different inpatient units, Betty Ford, for instance, they increased the stay of heroin users by, I think it was 35%. There's a county detox in Portland, Oregon. The increased stay increased about 70% for particular people who are using crack and amphetamines. The difference is about 90% because there aren't any medications that will help that subgroup. When you're working with people who are dual diagnosed or crack users and so on, the retention rate and the rate of cooperation that you get is really much more substantial with acupuncture.
Dr. Smith, you mentioned in what you were just saying and earlier when you were talking about acupuncture being helpful even for people in really extreme states or people dealing with delusions. At the Freedom Center, that's a lot of people who come through the organization, and so we're very interested in that. That's part of the reason we started our own clinic. So I'm wondering if you can talk specifically about that a little bit, or even, I know that there's been a little bit of local research about people diagnosed with ADD in children, and magnets being used in beads, and how acupuncture and beads has been therapeutic with psychiatric issues as well.
Well, you're asking two different subjects. We could start with the children, or we start with the adults. Which would you prefer?
How about the adults?
Okay. Using the same ear acupuncture protocol, that is 3 to 5 points on the outside of the ear, using the same points each time, you can really help people with serious psychiatric problems. There is one particular study that was done in Texas, Waco, Texas, where they had a facility. It was a private hospital that tended to refer most of the people there on to the state hospital. But in the private hospital, they had an average every 43 days someone in this facility was sent to state hospital. When we added acupuncture to their treatment protocol, there were no referrals to the state hospital for 900 days. That is, there were no referrals at all until professional jealousy temporarily stopped the acupuncture. And these people were given acupuncture without increasing their socialization and without making their program very effective, because the institution wasn't really able to make very many changes. For example, when we asked the staff what the difference was, they said, well, the patients used to sleep 14 hours a day. Now they sleep 8 hours a day. Community meeting used to take 5 or 10 minutes. Now it takes 2 hours. The patients want to paint the building. They want to plant a garden. Last week, she said, one of the patients asked, what happens when I get better? Those issues had just never come up previously. And we talk about something as an illness, and an illness often means that the person feels weak and feels tired and really can't cope very well. When people are taking acupuncture, they feel much less weak, much less tired, and their interest in coping and listening and being curious is much more, occurs much more.
And so the second part of the question about children and who have ADD diagnoses and the type of studies that have been done around that?
Yeah. I should mention, first of all, about the Waco, Texas study. All these people were on psychiatric meds. As the patients got better, the doctors tapered the medicine and so on. But this was a regular and not very well-functioning clinic that was then improved with the acupuncture treatment. For attention deficit children, we use these little magnetic beads, and these are small gold beads that are on a piece of bandage, and you put the bandage with the bead in it onto a certain point on the back of the ear, the back of the external ear. Patient doesn't have to push it, which of course is fortunate for kids who wouldn't push it very well. And we've had different children respond very well with autism and obedience problems and so on. But probably the best study that was done in Massachusetts, in Framingham as a part of the nursing system there in the city of Framingham. That's done a lot of famous research. In this case, they were working at a facility called Reed Academy. That is a residential facility with for boys who have significant mental health illnesses. They generally have all sorts of diagnoses, and they're put on a number of medications and so on. We were treating the kids based on the parents' consent and so forth, and we treated them for 6 weeks only. Then the results were looked at for a year afterwards, so we're looking at effects that lasted 1 year after a 6-week period of time. And most of the kids in the school were on the study, so we're not selecting the good ones or anything like that. We gave them a before and after screening test called the Connors, and you take certain questions on the Connors and gave them a score from 0 to 33, 33 being really very dysfunctional and 0 being no problem noted. Most of these kids had scores that were 25, 28, in that range. And after the beads, that is a year after that 6-week period, the scores were 50% improved. So now instead of 25, they would be like 12, or instead of 28, it would be 13 or something like that. Quite a substantial improvement. So much so that one boy who pulled his hair out in clumps for years, about a week after the beads were put in, stopped pulling his hair out, and 2 years following still had not done that again. His hair looked very different. We had a lot of kids who were reunited with their families because they were now more calm and able to focus and interact better. So the family could take them home. A lot of kids that were mainstreamed in schools and did really substantially better than what the school had been used to previously. We're doing further studies in Germany and a lot of different places in California, hopefully. One of the difficulties is that the beads don't require a license to use, and they're very cheap. So there's really no one would ever make money out of this treatment. And that in our world is a big deal. So we have to overcome that kind of difficulty.
And so it's entirely legal for anybody to use the beads.
Sure.
And there are school systems that have implicated it with students as well? Or?
Well, the school system... not the school system, one facility that is part of the citywide school system. Did it for a while. It's no longer doing it because there was medical people came in and it made them uncomfortable, and so they stopped.
And can you talk briefly in the note of legality on what the laws are around the 5-point acupuncture protocol in the laws in New York and also the laws in Massachusetts, like which states it's legal in and why, and just some information around that.
Well, most states have an acupuncture licensing law, and the licensing law says that if you're not a medical person, but if you studied acupuncture 3 to 4 years and you passed a national exam, that you can have a license to practice acupuncture independently. Some of those states require medical supervision, but most of them don't. So the states in the eastern region here almost all have acupuncture licensing laws. I think they all do. Then the question is, since the NADA protocol, the 3 to 5 point ear acupuncture protocol, needs to be given frequently, and it needs to be given in indigent settings, where there's really never going to be any money to pay a licensed person to come in, Could we not have an arrangement where the licensed person would be able to supervise and train other clinical staff, nurses and social workers and counselors and so on, supervise the other clinical staff just in doing the ear acupuncture protocol? An exemption clause to the acupuncture licensing law was passed in New York in 1988. It was part of the original licensing law in Connecticut and part of, I think, the original licensing law in Vermont. About half the country has Acu-Detox exemption. And in that half of the country, you have nearly 1,000 programs. So there are state licensed programs that use acupuncture according to federal statistics. In states that do not have this exemption clause, there's virtually no acupuncture that's done in drug and alcohol or mental health settings.
And that includes Massachusetts, too, is that right?
Yeah, Massachusetts had 3 or 4 programs that used this method 20 years ago. It's only the same 3 or 4 programs. And the few acupuncturists that work in those programs have been very dedicated and fortunate that the funding is present. But Connecticut, for instance, has maybe 30 or 40 programs that use this, and New York has well over a couple hundred. And I would assume that Vermont has more programs than Massachusetts at this point, and even though they've only very recently had an acupuncture licensing law. And it makes a difference. And not to have this clause means that the people in a given state don't have access to a certain kind of treatment.
What is the reason that Massachusetts doesn't have it? I mean, is there opposition to this, or?
Well, I'm sure there is. There are people who are acupuncture people, there are people who are medical people and so on who don't like this particular way of doing things. Very often the people that are affected, that is the patients and their families and so on, have very little voice in the matter and very little information about how well this works. The issue is not so much who is against something, the issue is can you gather people in favor of something. Because this method spreads, and it's spread all over Europe actually easier than in the U.S. and India and the Middle East easier than the U.S. because, again, the laws are more flexible. Once you have people who like the idea, then they do it. Because they see people sitting comfortably and they see that these are very small needles, and the interaction of ear acupuncture is much simpler and safer than ear piercing. Ear piercing is hardly controlled by any law. This is an exemption clause and potential law to benefit people with drug and alcohol problems and mental health problems. There aren't a whole lot of things that are done in society for the benefit of those particular rather large subgroups. And people have a lot of fantasies and mythology about, oh, you have to do this and you have to do that, when the reality is if you let the person slowly take charge of themselves and you let them access help and let them work things out, a lot of positive things can happen. And that just isn't a reality that people here are very familiar with. And so you have certain states that were lucky enough to have the right advocate at the right time, and they have a regulation that then the field really appreciates once it has the opportunity. And I mean, the acupuncture is done in all 11 city hospitals in New York, and comments from one of these studies that were unfavorable, no one cared because they knew on their own in their program that this was a positive experience. People in a state like Massachusetts, there's no way they know that that's the case. And in reality, sometimes you get ahead and sometimes somebody comes in last. And as the way it's going, in 3 or 4 years, virtually every state in the U.S. is going to have the regulation. And there'll certainly be a few that don't.
So we're about 3/4 of the way into the show, and I just wanted to ask you, just based on your incredible experience in working with these issues. There's a lot of debate about just the question of the war on drugs in general. We all know that it's very devastating, very racist and very classist, but there's also some concern that the approach of legalization and decriminalization may not be the best approach either. I just would love to hear your perspective on what you think U.S. policy should be on drugs and alcohol and just the whole issue of drug abuse in the country.
Well, first of all, the metaphor for everything we do in this society is the war. We have a war on poverty. Presumably we killed poverty, we blew up poverty, whatever. We have a war on drugs. You need a metaphor that doesn't involve war, because when you talk about wars, you end up talking about only extreme solutions and only mechanical solutions and who's the devil and so on like that. Drug abuse, mental health issues affect maybe 1 out of every 2 or 3 families in the whole country. You cannot do a war on yourself. There are regulations in most states that have huge penalties for possession and use of drugs. So the penalties make no sense. They don't accomplish anything. Virtually everybody actually in the criminal justice system who sees the practical details knows that. But in political situations, it somehow happens that the voters are going to vote for the politician that says something much more stringent. They're tough. It's a war. What else should I be but tough? How could it be anything else? And so you have a lot of falseness and a lot of not relying on people that actually observe things and not relying on the statistics that are obviously show that these long sentences don't mean anything. Wait a second. Mm-hmm. Having said all that, that does not mean you immediately go to the other idea and say, okay, make it all legal, everybody can do everything. That would be a catastrophic thing. And if you want to make things legal and available, why don't you try for food and housing and other things like that before you spend all your effort making something available that doesn't mean anything. During adolescence, in places where there's high unemployment and places where there are dysfunctional and abuse at home, the availability of drugs leads just automatically to heavy addictive use for a large percentage of people. And not to do anything for them, but give them free syringes and free drugs is a disastrous, terrible thing to do. And it all comes out of this war. Oh, we're going to have a war. Oh, no, I'm a pacifist. I don't believe in any war. Or why don't you find a mature, moderate, flexible stand instead of these all or none infantile approaches to things. You have people who are using and they need a certain amount of help and so on, and you can say, oh, we want to just do harm reduction. You've got to do more than that. You've got to aim for more than that. When you have a school, for instance, and I as a parent take my little 6-year-old into the school, what do I want? I want the school to have high standards and think that, yeah, my kid might be really smart. At the same time, I want them to be very flexible and forgiving in case my kid messes up a lot. High standards, flexible, and forgiving both at the same time is what you want. And that's the way all sorts of things in our world are done. And you can't say, oh, we're just going to have harm reduction reading. We'll teach harm reduction reading. That means you never have anything of quality, and you just compromise the spirit out of everybody. People don't think about these issues at all. Instead of, let's look at all the relatives I have, all the friends I have, let's look at people who are victims of abuse at home. There's more terrorism in this country that goes on in the home than anywhere else. If you define terrorism as unexpected, unearned punishment that just comes from the sky. Well, people walk in their own house at night. There's a whole lot of that happens. And working with drug and alcohol problems is immediately involves a lot of those issues as well. And you cannot do this by war or pacifism or whatever like that. You have to do it the way grown people help each other. And most of these discussions, you never even get to a sensible middle ground. Oh, you have to like it this way or you have to like it that way. That's like baby talk.
Have you had any success with, because I know there's the protocols really spread a lot, you were saying, in the hospitals and in the city, in New York. Have you had any success with the politicians really taking this more progressive view on the
There are a lot of
drugs?
politicians who are interested in these things. I say the politicians, as long as they are not being advised as how to behave to get more votes, a lot of them understand this quite easily. I was one of the founders of the National Drug Court Movement. I've met politicians, senior judges, and mayors, and so on like that in about 30, 40 cities in the U.S. Most of them understand this. It doesn't seem to correlate with running for office or getting votes. If the person's just standing there as a person, a lot of these things are not so hard to understand. Now, in academia, for instance, the understanding of these things is really quite poor because the middle ground, you can't write a book about the middle ground. You can't get votes in the middle ground. I don't know. There are all sorts of, the kibitzers are a disaster in this area because they're always, oh, I want to do this. There's one answer. Oh, you have one answer, and you're going to make that answer good for everybody, and you have one answer. And this is about people's lives, and there is not one answer and one moment to have one answer. And are you tough enough, or are you green enough, or something? It's just absurd. And if people would learn from 12-step approach and learn from these other things that are actually involved and come out of the effort to become drug-free and the effort of recovery, then they would get a lot further. And there are a great number of people who are involved in that, and mostly they don't have much room to say anything about it. On radio, for instance, on other circumstances, for instance. We always have to kill the magic dragon at one end or the other end of the tunnel. That's just silly.
So it seems that you mentioned the drug court movement, which is definitely growing in the U.S., and you were very central in making that happen. It's absolutely clear that it's much, much preferable to incarceration. But is there a concern that you're still sort of backing it up with the threat of incarceration and people in the
No, wait. Come on. You're don't say things so foolishly.
Well, I'm asking.
Yeah, right. But please. Drug court doesn't mean no one's ever incarcerated. That is not true. It's not the intention, not even vaguely true. It means you are trying to get people to clean up. Anybody, to break habits, anybody, there needs to be some sort of pressure. hopefully the pressure is from people who are concerned. But when you don't get people to stop habits without there being some kind of pressure of reality. Maybe they're all mature enough to do it on their own. But to throw in these magic things again that, is it too lenient? Is it too this? Those points of view are so simplistic and infantile, they ruin the discussion. They ruin lives. They ruin people. And everybody, you're taught in radio, you can't talk for yourself. You gotta voice the fears of the audience and so on. And we need to assume that the audience is simple-minded. And I don't know, maybe they are, but when you get out and talk with people, they're not. And all these debates and these things have to be framed in a way where the solution isn't something I have to knock down 50 10-pins in order to talk about the solution. Maybe we could talk about a balanced solution right away and assume that there is a flexible middle ground and accept that addiction is a real challenge and that it can't be worked out that way. I mean, the world's had a zillion years to work it out with dumb ideas, and they haven't done very much.
Should the policies around alcohol and nicotine be different or similar to the approach of other drugs, or do you see that as problematic, or do you think they're different kinds of things?
Well, first of all, alcohol is a drug that has a lot of negative effects. It is a drug that historically can be used in a moderate fashion so that people don't tend to use it in a huge way. There are some drugs like crack cocaine that there doesn't seem to be much indication they can be used in as a moderate fashion. If you use something in a moderate fashion in a private situation and you don't hurt people, the world's never going to know if you use it or not. What the heck? When you start doing things involve drunk driving and child abuse and so on like that, alcohol is much more prone to cause these problems than a lot of other drugs are. And that's alcohol used in an inappropriate way. And to stop a person from using that in an appropriate way to save their family's life, you got to have interventions, you got to have effort, you got to show some character. And you don't just stop it with cute ideas, we'll just do nothing, or we'll just do something. Nicotine, on the other hand, tobacco, whatever is actually in those things, does not distort behavior in the way that these other drugs do. It is a poison that's either brought in your lungs or not. And if you live in a house, I would think, having grown up in a house that was utterly filled with tobacco smoke, it hurt me. And I didn't have much choice about it, and I'm glad that somebody's interested. And then again, if the person wants to have cancer and they want to do all these things or they're afraid to stop, as long as they're not poisoning somebody else, what the heck? But make everything a drug just because it's these things are very different.
Dr. Smith, we're just about out of time right now, so I just want to thank you very much for coming on the show and talking about a wide range of issues that are really important to our listeners.
Yeah, thank you very much.
Well, I did it because I know both of you, and both of you are very committed to helping people and hardworking people.
Well, thank you.
And so it's a thank you for your efforts.
Oh, fantastic. Well, thank you very much. And people can check out acudetox.com for more information on the NADA protocol. Thank you, Dr. Smith, for joining us from Lincoln Recovery in the South Bronx. And you are listening to WXOJ LP Northampton 103.3 FM.